Hello, and welcome to today's webinar, Reducing Medication Errors Through DNA Testing. I'm very excited to present this topic as our risk pool has recently launched a medication safety program that we believe will result in improved health outcomes for our covered individuals, while at the same time reducing overall medical costs. My name is Wendy Parker, and I'm the Executive Director for HealthTrust. I've been with the association for over 32 years, and I'm very excited to have with me today Scott Megill, who is the President and CEO of Coriell Life Sciences, and he's going to help me explain this valuable program. Over the next 30 minutes, we are going to cover a variety of topics. We're going to move through them rather quickly because we just have 30 minutes, but we wanted to make sure to give you a good overview of the program and how we've worked to implement this over time. My hope is at the end of the presentation, you have a solid understanding of what a medication safety program is. And oftentimes you may hear this referred to as pharmacogenomics. And so we'll learn about that as we go through the program. I thought it would be important, though, before jumping into the actual program, to tell you a little bit about us to put in context why we rolled out this program and why it may be important for other risk pools like us to consider this. And so first, we're a risk pool located in New Hampshire. We're a little unique in that we cover schools, municipalities, counties, and other quasi-municipal districts in New Hampshire. We offer a full range of products from medical, dental, short-term, long-term, life insurance, and pharmacy coverage. We do everything, as many of you do, that an insurer does, except process claims, and we rent our networks. So to do that, we utilize Anthem Blue Cross Blue Shield on the medical side and CVS Caremark on our prescription drug side. We have 58 employees, and we represent 360 individual groups within our population. In addition to providing what I'll consider traditional insurances, we also do a lot of value add programs, and the medication safety program is certainly the one I think is the most important we've done over the last several years. But we feel that we've had other impactful ones, such as expert second opinions through Included Health, a Smart Shopper program, which allows our employees to avoid a deductible if they go to cost-effective providers within the state. And then we've been investing heavily in wellness since the early 1990s, providing both comprehensive education, but also really good incentives to try to get people motivated to participate. And you'll see from this slide, although our mission is rooted in providing cost-effective, high-quality benefits, it's really our vision that I believe applies to this. And that is really to be New Hampshire's most trusted partner in achieving optimal health through a culture of wellness. And we believe the medication safety program propels us towards achieving that vision. Now on this slide, there's a lot of information here, and given the time, I'm not going to go through all of it, but I thought it would be important to provide it to you. But I do want to call out a couple important things from this slide. One is our size. I think it's important that you understand the commitment that our board has made to offering this program. We currently have 53,000 or so individuals covered by one of our medical plans and pharmacy benefit plans, and they are all eligible for the medication safety program. Working with CLS or Coriell Life Sciences, as we began to evaluate this program, it was determined using our own claims data that there could be savings in excess of $37 million over 3 years. Now, of course, that's nirvana if we get everybody to participate, but those were staggering amounts of savings that are potentially out there. But I think more important for our board was really finding out that 59% of our covered individuals take at least one medication that is affected by genetics. And the ability to give them this information in a report at no additional cost to them, the way we chose to fund the program, really allows us to reach that vision of providing opportunities and tools for our members and covered individuals to reach optimal health. And so I'm excited to turn it over to Scott, have him explain to you the history of their organization, which I think is really important and why one of the reasons why we chose them, but also the simplicity of the program and the power of the information that comes from that. So Scott, I'm going to turn it over to you and let you explain your organization and the program.
Thank you, Wendy. My name is Scott Megill, President and CEO at Coriell Life Sciences, and just a little bit about us. So the Coriell Life Sciences company was founded as a spin-out from the Coriell Institute for Medical Research, which began back in 1953 by Lou Coriell, who helped to commercialize the polio vaccine and many other discoveries related to biobanking and personalized medicine. In 2013, we created the organization to leverage some intellectual property that had begun at in a research study focused on how to actually use genetics in the clinic, and with a particular focus on medication association to genetic variation. So as it turns out, your genes mean a lot when it comes to whether medications will actually be safe and effective for you. And the problem is really quite large. Medications don't work for everyone. Prescription drug spending in the US alone is more than $300 billion a year. And the FDA has said that about half of the drugs that we are prescribed and regularly consume don't actually, are not effective for our care. And of course, they're not safe for everyone either. So medication errors result in more than 1 million emergency room visits per year in the US alone, and more than 100,000 deaths. It's actually the 4th leading cause of death in the United States. When it comes to genetics, genetics has a lot to do with the pace at which medications will move through an individual's body. The same drug taken by 2 different people based on variations in the human genome can react differently. I myself am what's called an ultra-rapid metabolizer on a gene called CYP2C19. That means for me, if I take the drug Plavix, which is one of the best-selling blood thinners in the world, that drug will actually race through my body too fast to ever activate in its effective form. So I'll receive no therapeutic benefit whatsoever from taking Plavix. I'm one of about 1/3 of the world's population that has this genetic variation. There's no way my doctor would know that without actually taking a genetic test or seeing the downstream impact of that medication not working for me. So if I ever go to the hospital for a heart attack or a stroke or a blood clot, I now know that my doctor should prescribe an alternative to Plavix that will actually work with my genetics. And so roughly speaking, people can be categorized on a medication by medication basis into drugs that will work, that won't work, that are safe, or that are unsafe. And now we can test for that using genetic testing technologies. But that does need to be combined with lots of other information about medication prescribing, including, is there a chemical reason 2 drugs shouldn't be used together? Should drugs not be used with the foods that people eat or the things they drink, the things they smoke? Are there issues related to the age of a person and toxicity concerns, whether they're too old or too young to be able to actually tolerate the medications they're prescribed? Should certain drugs not be prescribed because of the conditions they suffer? All of this really needs to be tackled in total in order to be able to really prescribe in a precise way. So we've created a program that utilizes this genetic testing technology, but also leverages more traditional medication therapy management processes to ultimately bring together all of the best available guidance for patients and doctors caring for those patients. So that program is called Corigen, and that is something that we offer out using a series of different components, first starting with population analytics, where we can look at an entire population of patients or members and identify those that are at the highest degree of risk. Then we outreach and engage those members with a series of educational materials, informing them of the benefit of enrolling in a program like this. We facilitate all of the sample processing using typically in-home collection for DNA samples. That's a saliva test kit that looks very much like a 23andMe or an Ancestry.com kit. But it provides enough DNA material that we can interrogate the genetics of that individual for those medication-related variations. We then utilize pharmacists who have been trained to use this information and provide information back to the patient's own doctor on recommendations for change. And then, of course, we monitor the results of the whole process, looking for both patient health improvement as well as economic improvement. So that ROI analysis starts with really looking at an entire population to see who among this group are taking medications that might be impacted by their genetics, are at risk because of potential downstream impacts of medications not working or safety concerns, and ultimately results in a potential ROI, a return on the investment for implementing a program like this. Those individuals are then targeted for outreach, and that can follow many forms. Often it's mailers to homes, it's email communications, targeted text messaging, whatever is really the best communication channel to reach those individuals to let them know that there's now a new benefit available to them within their health plan. They order that test kit, comes right to their home, and that kit itself is very simple to use. It's spit in a tube. It's not the most elegant thing, but spit in a tube, small amount of saliva is all that's necessary in order to actually test for DNA variation. That same box that it arrived in is pre-postage paid for shipping back to one of our laboratories. We have about 130 different labs that we work with across the country. And that test is resulting in a report that then allows a pharmacist to determine what should be done for this person's medication plan. So those pharmacists operate in a telepharmacy approach. So they schedule a one-on-one appointment with the participant. They use a tool that we've built called GeneDose Live that brings all of this information together and allows them to model medication regimen changes in real time. So if one drug looks inappropriate for someone because of genetic or non-genetic concerns, they can see within the tool which other medications would satisfy that same therapeutic intent, but provide a much less risky alternative for that patient. So for me, again, someone who can't take Plavix, GeneDose Live would show that pharmacist that ticagrelor or prasugrel are actually better choices for me because they don't actually operate through the same genetic pathway, and I have nothing that physiologically would block those drugs from working. We also provide direct to the patient what's called a medication compatibility report. The MCR is intended to be human readable. You don't have to be a clinician, you don't have to be a geneticist, but what it does do is provide you with lifelong information about what you should avoid now and in the future when it comes to prescribing. So I don't take Plavix today, but because of information found on my MCR, I know that I should never take it in the future. My genetics aren't going to change. They are fixed for me for the rest of my life. So as it happens, that drug should never be prescribed, and I'm now armed with that information for any clinical encounter that I have in the future. That's the immediate value and long-term value of this process is, what should I change today and what should I watch out for and inform my physicians of in the future? Then, of course, we need to measure, did this actually work, not only for the patients, but for the program? So there's a whole series of monitoring steps that go along with this process to ensure that we're actually seeing the trending of reduced hospitalizations, reduced patient and doctor visits, unnecessary medical tests, that they're all going in the right direction, and that we can actually attribute an economic savings value to that in the process. And now I'd like to talk through a couple of case studies that show what some of those real-world outcomes have been, and talk a little bit about the success that we've seen in the field. So one of the case studies that has recently been completed was a population in a self-insured employer who targeted specifically people at very high risk. So this was a group of initially about 6,000 eligible individuals, where 1,000 or so have enrolled in the last 6 months. So this was through that same process of outreach, education, and engagement that I mentioned. But just a little bit on that group. So about 51% of those individuals were on medications at the onset that we knew had some potential implications from a DNA perspective. And about 37% were on high-risk drugs from an interaction standpoint. So just looking at the chemical interactions between the drugs in their own regimen. So after only 5 months, we were able to start measuring some of the impact using a risk-normalized cohort as a comparator. And what we saw in that 5-month period was a reduction in cost for the individuals that went through the program of about $266 per month per patient. So over the course of that period for those who went through the program, that equated to about $250,000 in savings to the plan. And that's over and above the costs of actually doing the genetic testing and the pharmacy review itself. So the returns are actually quite strong on all of the programs, assuming we target well and that the program is well supported. In another case, we've been working with a retirement system in the state of Kentucky. It's the Teachers Retirement Systems. And since 2017, they rolled this program out. We've been able to measure not only the results from a patient health improvement perspective, but now more than 3 years of economic value. And we've been able to see what that trending has looked like, so much so that this has now been peer reviewed and published in the Journal of Personalized Medicine. Actually, March 8th, that publication hit the press. So again, very similar pre-programmed statistics. About half of the population were on medications where DNA could be impactful. Because this was a retiree population, we saw a higher percentage of retirees that were on high-risk drug interactions. But what's most staggering here is the cost implications for the program. So among about 10,000 people that enrolled, we had enough data both pre and post intervention to be able to measure about 5,200 of those across that entire 32-month period. That resulted in a cost savings for the program of $218 per member per month, around $7,000 per member over the 32-month period, with an accumulated savings of around $37 million. So really significant for them. And again, that paper has been published and peer reviewed. So certainly lots more details there are available. Some other programs that have launched in the last year working with us, a self-funded international reference lab of about 47,000 employees, a US-based manufacturer of, it's actually laboratory and medical equipment, 70,000 employees. In total, around $500,000 in kind of traditional self-funded plans or public sector entities, but we're also now working with some country governments as well, including Saudi Arabia and Scotland, to launch at a much wider scale. So this whole technology and implementation is catching on quite rapidly, which is great for everyone.
Well, thank you, Scott. And, landing on this slide is really important. For me, it all comes back to this. Wouldn't you want to know if the medications you're taking now or could take in the future are the safest and most effective for you? Wouldn't you want this for your children? And for our board, it was a resounding yes. We want our members to have this information. And so Scott talked a little bit about targeted populations, and many groups that he works with do target high-risk populations. But for us, because we have within our public sector risk pool, people throughout their career. So when they start with us in their early career, right through retirement, it was important that we invested in them for the long term. So everyone is eligible under our program. Now, you might wonder a little bit if you're a board member or staff person, what does this look like to roll it out? What did you go through? And for us, it really was a couple-year process to go through it, because what happened was I was at a conference with board members. They went to a session on pharmacogenomics, came back and said, Wendy, we want to learn more about this. And quite frankly, I had to Google it and see what it was and learn about it. And they were just excited about the program. And it was all they talked about when they got back. We were lucky enough to come across the retirement fund in Kentucky, who, as we know, public sector entities really work to share information, and we contacted them. They came to one of our board retreats, helped us learn about what they had done, what they were going through, lessons learned from them. Then we met CLS, had Coriell come in and do a presentation to the board, worked on that, went through the analysis, and then finally came to the board and said, here's a recommendation, here's how we'd like to implement this, and here's why it's important, again, for that mission vision within our organization. Happy to report they were very supportive, and in August, as I mentioned at the beginning of the presentation of last year, during COVID, we rolled that out. And so we're about 7 months into that program, but a lot of education and training to go up to that. Lessons learned for us really is communication, 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 because it is different. And I know every risk pool out there says, I'm unique, we're different. Well, I think that too. So New Hampshire is very unique in the way I think they want to hold on to their personal information. So we've had to do a lot of education that it's, a safe process. Your DNA is kept confidential. We as HealthTrust are not going to see that. And quite frankly, I think that's going to be our biggest communication challenge, even going over the next year, is that safety of that data with everything going on in the world. But again, education. So pre-launch, we worked closely with CLS. closely with our engagement team, creating postcards, going to workshops, doing presentations like this with our member groups. And then once we went live, the work certainly didn't stop. I think it really just began, because now we need to continually get this out in front of individuals. And so we're using forward-ready emails. We have secure member portals, secure enrollee portals, really putting messages out on there, getting out to association groups. And then the other thing that we're learning is that we need to start telling personal stories. So Scott shared with you a little bit about his metabolism and how certain medications for him. And we think that getting those stories out will help better, but you can't let go of the traditional things either. So this slide is just a quick compilation of email footers, notepads, ads that we're putting in our member association publications, just to continually remind people about the program and that it's available to them. But going back to those personal stories, that is really what's important. And so on my staff, there are 3 of us that were willing to share our stories with our membership as to what's happening. And so this slide just gives you a quick overview of my experience as a participant, not as executive director, but as a participant going through the program. And for me, I am a fast metabolizer. So certain medications go through my system really quickly. And I learned that going through this. And I was having some health issues that I've been working with my doctor. He had added a couple of medications, but come to find out, I don't need additional medications. I just needed the right medication. And by having this test done, I'm able to see that one of the medications was going through my system too fast and I wasn't getting the benefits. We've switched me to another medication. Happy to report I'm sleeping well. I feel better, more productive, and really shows the value of the program. Now, for those that aren't even on medication, so we often get questions of, should I do this? I don't take any medications today. Why would I do this? And here's the reason why you would do that. Your DNA isn't going to change. And so my DNA is going to be the same today as when I'm 80, 90, or maybe even 100. And so I really, armed with that information, now know, God forbid I ever need an organ transplant, there is a very common organ transplant rejection drug that will not work for me. And I wouldn't have had that information. And so that could be life-saving information for me in my future, that I now have that. And so that to me is really important. Jennifer, who also works on our team, has a young son, deals with ADHD issues. She has been a lot of trial and error prescribing with him, trying to get the right medication, what works, what doesn't work. And now, armed with the information out of his medication safety report, her and her physician, his physician, are able to better identify what drugs make more sense for him, what will work better. We can't guarantee there's no trial and error with any medications, but certainly she has a better roadmap as to what will work for them. So really powerful. And we know that, ADHD is prevalent in our population. And so Jennifer is not the only one of many who could benefit from that. And rounding out our experiences is Krista. Krista is one of our younger staff members that we have. And like a lot of young people, dealing with depression and anxiety and trying to find their way through that. And so with depression medications, again, a lot of physicians trial and error, what works, what doesn't work. And sometimes people, quite frankly, give up because maybe the side effects on the medication, they're not seeing the benefits, and the side effects say, I'm just not going to take my medication. And we all know that's not a positive place to be. So Krista, now armed with this information, working with her physician, has information to sit down and say, okay, let's path out what will work for me and get her the medication, the right medication at the right time. And that's critically important. And we believe that, there are a lot more stories to tell on this. And as our population increases in percentages, we're hoping that we have others that come forward and tell their story as well. But we felt strongly that we wanted to share our personal stories as well. And so I'll leave you with this slide before we open it up for questions, because every time someone comes back to me and says, okay, well, why did you do this? Or why would I want to participate? And in the end, I go to one response, and it's covered in this slide. And it really is, if a medication is unsafe or won't work for you, wouldn't you want to know? And I think everyone would say yes. And that's why this program is so important. So thank you for your time. We hope we've taught you some new things as we went through this webinar, and now we'll open it up for questions.